The pancreas is connected to the caudal wall of the stomach and the duodenum. The pancreas often looks like fat, omentum, or mesentery, and is not recognized on ultrasound as a distinctive organ. If the caudal wall of the stomach or the duodenum is on the ultrasound screen, the pancreas is also present. Pancreas is mainly recognized on ultrasound when it is abnormal. With higher frequency transducers, pancreas can be seen as a distinctive organ in cats. Normal pancreas is evaluated during the evaluation of the caudal stomach wall and duodenum. Normal pancreas is often not even recognizable. Lesions in the area where the pancreas is supposed to be are usually pancreatic lesions. Normal pancreas is often not recognized, so landmarks are extremely important in locating the pancreas. Normal pancreas is caudal to the caudal stomach wall and cranial to the transverse colon. As you move the ultrasound beam toward the patient's right side, the stomach disappears and the transverse duodenum can be seen. The main body of the pancreas is caudal to the transverse duodenum. As you reverse directions and move the ultrasound beam toward the patient's left side, the left limb of the pancreas is caudal to the caudal stomach wall. If you see the extrahepatic portal vein, the pancreas is ventral to the vein. In the far left of the cranial abdomen, you sometimes see spleen and the cranial pole of the left kidney. The tip of the left limb of the pancreas is caudal to the caudal stomach wall, dorsal to the spleen, and cranial to the cranial pole of the left kidney. In this video, the laser light represents the ultrasound beam. To search for the left limb and main body of the pancreas, the transducer is held perpendicular to the caudal wall of the stomach in the sagittal position. Slide the transducer to the patient's right side and adjust the transducer position by sliding cranially or caudally as needed to keep the caudal wall of the stomach centered on the ultrasound screen. In this ultrasound video, the green arrow indicates the area where the left limb of the pancreas is expected to be in a normal animal as you slide the transducer to the patient's right in a sagittal position. Try to keep the caudal wall of the stomach centered on the ultrasound screen by sliding the transducer cranially or caudally as needed. It may be necessary to increase or decrease depth as the ultrasound beam moves to the patient's right side. In this video, the laser light represents the ultrasound beam. After following the transverse duodenum to the patient's right side, rotate the transducer to a transverse position and slide caudally to follow the descending duodenum. Try to keep the transducer perpendicular to the patient's body and keep the duodenum centered on the ultrasound screen. In this ultrasound video, the transducer is already in a transverse position over the descending duodenum. Note the right kidney to the left side of the ultrasound screen. The green arrow points to the mildly inflamed pancreas dorsal to the duodenum. Note the anechoic pancreatico-duodenal vein dorsal to the duodenum. In this case, the transducer in a transverse position is sliding cranially to follow the descending duodenum back towards the transverse duodenum. The duodenum abruptly changes from a short axis view to a long axis view as the ultrasound beam reaches the transverse duodenum. The green arrow identifies the location of the normal pancreas in this dog. There are no common artifacts associated with normal pancreas. There are no standard measurements of normal pancreas in dogs. Abnormalities are measured for comparison in future studies. In cats, the left lobe of the pancreas should not be greater than 9 millimeters thick. The main body should not be greater than 9.5 millimeters thick, and the right limb should not be greater than 5.9 millimeters thick. The pancreatic duct in cats tends to dilate with age, but should not be greater than 1.3 millimeters in diameter in an asymptomatic cat. A dilated pancreatic duct in an asymptomatic cat probably indicates previous episodes of pancreatitis. In this ventral midline sagittal view from a cat, the normal main body of the pancreas will be a small tissue density caudal to the transverse duodenum, ventral to the extrahepatic portal vein, and cranial to the transverse colon. In this right ventral transverse view, the green arrow points first to the right kidney, then to the ascending colon, then to the descending duodenum. The normal right limb of the pancreas is a small tissue density between the duodenum and ascending colon in this 11-year-old, 7-pound toy poodle. A normal right limb of the pancreas is often easier to find in dogs than in cats. The pancreatico-duodenal vein is often seen as an anechoic tube in the right limb of the pancreas and running alongside of the duodenum. In this transverse view over the right kidney, the arrow points to the pancreas dorsal to the duodenum. The anechoic circle, and then tube, is the pancreatico-duodenal vein. The vein will show color with color flow Doppler.